The Indian Medical Association has appealed to Prime Minister Narendra Modi to come up with a central law to check violence against healthcare personnel and declare hospitals as safe zones with mandatory security entitlements. The demand was made by the apex doctors' body in wake of the rape and murder of a trainee doctor in Kolkata's RG Kar Medical College and Hospital. The IMA listed several demands in the letter to Prime Minister Modi, including a central law to check violence, security protocols of all hospitals should be no less than airports, declaring hospitals as safe zones, overhaul of the working and living conditions of the resident doctors, meticulous and professional investigation of the crime, and appropriate compensation to the family as well. The centre has also formed a new committee to look after the safety of healthcare officials. Meanwhile, the Supreme Court has taken suo motu cognizance of the case, and it will be heard on Tuesday by a bench led by CJI D.Y. Chandrachud. On the other hand, a protest has broken out near Salt Lake Stadium of the case. The government also imposed Section 163 in adjoining areas of the stadium. Joining us at this point is Dr. Rajiv Ranjan, former RDA Secretary, AIIMS Delhi. Dr. P.S.V. Rao, Consultant Surgeon, Manipal Hospital, Hebbal, Bengaluru, also joins us live. Dr. Swati Maheshwari, Internal Medicine Specialist, is also with us on the broadcast. Let me make a start with you first, Dr. Rajiv Ranjan. Which are the urgent steps which you believe now the centre should take for medical professional safety?
Good evening, everyone. The urgent step, which we have been demanding it from long, it's a long due thing which we need from the government of India, like the Central Protection Act. I was a part of the team who were involved in framing, drafting the Central Protection Act in 2019. That time also, the case which happened with one of our colleagues in NRS Medical Kolkata, he was brutally assaulted by some local goons, and he was in the hospital fighting for his life and death for more than 15 days. At that time, such protests and all started across India. And then to please us, the government of India and all the different authorities asked us, and at that time also our demand was to give a concrete solution to this thing. Because look, now and then everywhere, every day, you take out every day, one or the another healthcare professionals are being targeted for for their any need. So at that time we framed the law. We framed the bill. It was drafted, and we were assured that it will be put in the in the Parliament. Before putting in the Parliament, I do remember that on 2nd of September 2019 it was put in the public domain for any inputs from the public. But to our dismay, it was not taken in the Parliament, and further COVID came, and the thing is here. So if we could have did it at that time, I think this case would not have been in front of us. So my appeal to the government is that for some, things are there, like fake cases are also there and real cases are also there. If there is so hue and cry for the fake cases, when we have a solid and concrete evidence in this case, why the government is not taking the cognizance, why there is a blame game, things are going on, state government, central government, or whoever the authorities. So our concrete thing, our demand is that we should be protected not only from this rape or something like that, and entire healthcare services. In that draft, we have mentioned even the ambulance driver, even the ward boy who is associated with the healthcare facilities should be taken care of, should be given a full protection so that we can work in a free environment to give our best.
Okay, let me in fact quickly take that across to Dr. P.S.V. Rao. Dr. P.S.V. Rao, is the need for this central law, for this new act to be enacted? Is that the pressing demand of the Indian Medical Association and doctors nationwide?
Good evening to all on the panel, to you, Uday, and to the viewers. I think it is very obvious. There is hardly any question about it. Too many doctors have been beaten up. Too many doctors have died for causes of not because of anything they have done except to try and save something. People have been beaten up even when a patient is brought dead and certified dead, as if the doctor is responsible for the certification. And many hospitals have been vandalized. People on duty have been attacked and maimed, and people have died. And if the men themselves are insecure, you can just imagine what is happening to the women. And please do remember, women form a large part of the medical staff. It is not only the doctors. Like what Dr. Rajiv said, various employees get hit, the nurses, anyone on duty. And it is even more like the article that I have written today, which has come out in the Sunday Guardian. I have mentioned that the most vulnerable places are the emergency ward and the ICU ward, because that is where the critically sick are, and that is where the agitated attendants are there. And this is worse. You do something, and I've also mentioned in this article how criminal gangs are running all kinds of rackets. And if any doctor doesn't submit to them, then that doctor is also targeted. This is, and it is high time. I mean, we have been asking for this for years. What is the point of just having one committee after another and just having some kind of law which is not passed, or if it is passed also, there are many laws which are not implemented, and then there are judicial delays. You have forensic evidence being either suppressed or being played around with. And in this particular case, you are allowing goons to go and destroy all the evidence also. And what is the police doing? And I also put in my article, I have also emphasized the importance of the institution also. It is not only the police, not only the law keepers. The institution also has to give us protection. The institutions can't wash off their hands. Now you're having this principle being also dragged into this whole thing. Yes, obviously, if any institution, medical or anywhere, should have be responsible for the protection of the people working in that institution. And in my article, I've also put out the American statistics, which shows that the hospital industry is, the hospitals are a far more dangerous place than even the construction industry, which most people think construction industry is the most dangerous place to work in. I put out the American statistics itself. If you don't believe Indian statistics, I put the American statistics. It clearly shows the hospital is the most dangerous place to work. And I put out all the reasons why the hospital is far more dangerous. And the law should not only be immediately implemented, it should be put into effect. And all state governments should be responsible for the law and order situation in their state. And as I have often mentioned on NewsX in the last 1 week, the Calcutta, when my father was posted in Calcutta in 1970s, I was in CMC Vellore. I would go to visit him. And I was amazed at women walking at 12 o'clock in the night alone. It was the safest place in India. And now it is the most unsafe place in India. Maximum amount of rapes and murders and women harassment is all coming from Calcutta. And I am amazed, there is a lady sitting as the chief minister for the last so many years, and instead of protecting her, half the population, this is women form half the population, you are allowing this kind of unruly things. How much of violence can anyone tolerate? And we are in the job of saving lives. Now, if our own life is at risk, what do you expect us to do? And I have been a surgeon for 46 years now. I can't see what is happening now. We were far safer when we were young. These young doctors are risking their life, and I really feel for them, and that law has to be passed immediately. It should be executed, and every state government which doesn't protect doctors should be taken to task.
Okay, let me in fact quickly also take that to Dr. Swati Maheshwari. Dr. Swati Maheshwari, do you believe that the protests by doctors, by your fraternity will continue until finally action is taken? Will you now not accept any assurances and words, but you will want them to translate into action? Looking at this shocking case and incident in Kolkata?
Absolutely. I echo all the sentiments of my co-panelist. And see, one thing is very important over here. It's been a long asking demand from the doctors, and just setting up a committee is a positive step, but definitely not a sufficient one, because what it looks like is you're trying to buy time for this entire sudden meltdown to cool down. it doesn't look like you're really serious about, putting this Central Protection Act in place. We do need to understand that we already have 26 states. This act is already there, but is it being followed? Is the enforcement there? Is the implementation there? Is there legal accountability for such acts? So there has to be a national oversight for all these acts. There has to be a speedy justice to any such cases, because whenever such cases they erupt, they are very sudden, because such kind of aggression and violence are very sudden events, and therefore very speedy justice is required. Most of the states, even the police personnel don't know about this act. When the doctors go and complain and they want to lodge a complaint against it, even the police personnel are not aware of this act. And so, you can realize as to how pathetic the entire act is, how pathetic the awareness about the act is. So it has to be something which has to be very, very concrete. And, when it comes to West Bengal government, it looks like it is sabotaging the entire event that has happened. It is trying to create a state suppression for the entire doctors, for that matter, because giving out such kind of prohibitory orders for any kind of dharna, or transferring the doctors who were supporting the dharna, or for that matter reinstating the principal, all this shows that they are using power to hide all the wrongdoings that have happened. So there is a very, very clear need for a central government to give out clear indications to the state governments also, and to create a ecosystem, to create an environment for the doctors to feel safe while they are working. It's been really a long demand, and we need to understand that there are a lot of other root causes to this coming up, be it overcrowding, be it insufficient resources. All this has to be also looked at, and also the security personnel that should be there. The hospitals should be a safe zone, as has been demanded by the IMA. It is a very, very apt demand that has been put there, that the hospitals should be, completely manned by security personnel, so that whoever is working there, all the doctors and the other paramedical staff, feel safe while they are working there. And that is definitely a paramount kind of a request that is there, and that should be looked after. Again, what happens is, when such kind of incidents they happen, they are there in the media, people are talking about it, for 10 days, 15 days, probably a month. And after that, everything dies down. And like as one of our co-panelists, mentioned, that it was in 2019 that they drafted it, and it is still not a law. So, again, it goes under the carpet. Nobody worries about it. And then it is completely forgotten till another such kind of an incident happens, and we all rise together. So I think it is time now that the government should take some concrete steps, protect the doctors and the paramedical staff that is there, so that they can do their best, they can deliver what they are required to do, and not be worried all the time about their safety. One more thing which has been very demoralizing, and I would say disheartening this time, unlike Nirbhaya, the entire country was in an uproar and demanding justice. But unfortunately, this time, it looks like it's only the doctors who are leading the march, who are there and asking for justice. And I don't see a complete uproar, which should have been there in the entire country, for this girl who has been victimized, and also for the doctors who have, given selflessly to the society without worrying about anything else. I think the people as a society should also rise to the equation, to this kind of situation that is right now. And we should, accept something which is very concrete from the government only, such kind of committees, or, just a willpower to say that, we'll be doing something in future, I don't think is suffice.
Right. Let me, in fact, get in now Dr. Aseem Maiti as well, protesting Dr. Arjikar Hospital into the broadcast as well. Dr. Maiti, now, as far as your protests are concerned, when would they end? What is your single point demand to the centre and the state? And are you satisfied with the pace of the investigation so far? Dr. Maiti, can you hear me? Okay, I think we've lost that connection, unfortunately, with him. But let me quickly go back across to Dr. Rao. Dr. Rao, now the fact, of course, is that, the investigation also has been very sluggish. Now, there are new theories coming to light. We still don't have a concrete breakthrough yet. Is that also disappointing? Dr. Rao? Okay, I think we are having some major trouble with our guests there. But Dr. Maheshwari, let me quickly draw you in here. Dr. Maheshwari, after this incident, there has been shock and outrage. But there have been more assaults from Uttarakhand. we heard of a case of a medical worker being assaulted. I think in Mumbai also now, another case has come to light. So these, incidents unfortunately are continuing unabated. What do you make of them?
Absolutely. And that's why we say that it has to be a Central Protection Act, because it just can't be limited to one state or two states. What we are seeing right now is, across India, such kind of notions are there. People are getting aggressive. They feel that the doctors are soft target. They are vulnerable. They can do whatever they feel like, and they can be violent. They can rape. They can, kind of harass them. I think there has to be an end to all this, and only a central government can do such kind of steps wherein they can pull all the states, make this a compulsory act where people do realize that something like this is there, and in case they try to do all this, then there are harsher punishments for them, and they would be behind the bars. But right now, most of these culprits, they don't have any fear in them, and they feel that it's very easy to target the doctors or any those healthcare paramedical staff that is there. And look at West Bengal also, like you were talking about, as to where this whole investigation is going. It's just so hypocritical that a chief minister is leading a protest against her own system, which she is leading, and and the kind of efforts that they have put in to wipe out the entire evidence that was there. It is very, very shameful, I would say, and very demoralizing for the doctors, especially because you look up to the state or the government authorities thinking that they would be our protectors, but it doesn't look like that they are the protectors. They are in fact letting the people enter the hospital, destroy the evidence, putting these prohibitory acts in place so that the doctors cannot voice their concerns. I think this is all like you're trying to choke the entire system, and this shouldn't happen. It looks like the government is not sincere at all. The government is not empathizing towards the female doctors. You might be leading a protest just to show that face, but actually what your actions say is completely contrary. So I think they need to do a recheck on their behavior as well. They need to realize that, women force needs to be protected, and we have seen so many such cases, every 1 month or 2 months, such kind of brutal cases, they come up. So something has to be done, and we can't kind of say that, the other crimes and this crime has to be put into the same bucket. Not at all. It is a very, very different kind of crime, and something major has to be done to deter the people who think that they can get away with such kind of crimes. So I think the Supreme Court, the central government, everybody should put their hands together and, think of something which is out of the box to stop this rampage that is happening, be it 2-year girl, be it infant, be it, ladies of 68 or 70 years of age. Nobody is being spared. So I think it is time that women's safety in India should be a prerogative, and it should be urgently dealt with.
Yes, Dr. Ranjan, we should have made an example of this Kolkata case. The way, we fast-tracked justice, the way punishment was given to the victim, the way the investigation was completed in record time. But unfortunately, that's not happening. The exact opposite seems to be happening currently, Dr. Ranjan.
Yeah, look, as Dr. Maheshwari said, the government is not at all serious. Okay, and you see, you also mentioned that there were some cases 2 days back in Uttarakhand. Yesterday it was in Mumbai. And look, n number of cases are happening, and it is not coming to the light of the public. So things like CPA Act, a very concrete act where each and every person of a country should be aware that if we do any injustice, any aggression or any incident like this towards our doctors or medical fraternity, we will be punished. And they should be well aware of the punishment also. Because I didn't mention at that time that CPA, when we drafted that CPA, the punishments were like immediate punishment, and initial was like 6 months, which can be extended to 5 years. And there were monetary punishments also, like from 50,000 to 5 lakhs. So each and every citizen of our country should be aware that the healthcare personnel should not be taken so easily, and they should be soft target, and we can assault them or do any untowards toward them so easily. So this needs to be taken care of by the government, and it's a sincere appeal to the Honorable Prime Minister of India and whosoever, even the Home Minister of India, Mr. Amit Shah ji and Modi ji, to please take in sincere thing into this case and give us the justice to the entire medical fraternity, so that we should give and deliver our best, because we were the one who helped the country and who helped the nation during the COVID. So please don't let us like that.
Right. Let me, in fact, quickly go to Dr. Rao for a closing comment. Dr. Rao, as far as now this particular case as well is concerned in Kolkata, are you disappointed with the pace and the nature of the investigation so far, and what is needed so that people have faith once again in the system?
Uday, not only me, the entire fraternity is deeply disappointed, because instead of properly investigating the case, collecting the evidence, what is being done is to destroy the evidence, suppress the whole thing, and frighten anyone who is going to provide evidence. This is, and the goons and the people involved in it are being encouraged, and this is a classical way how these things are handled. And finally, when it goes to the court, first of all, there is delays in the court, and there is unending delays. Justice denied, delayed is justice denied. And when it does come up, the judge is unable to pass, even if he realizes that someone is the criminal who has done it. He is unable to do anything, because there are so many technical defects in the way the evidence has been collected, and as the case has been put up, that most of these cases eventually get thrown out on technical grounds. So it is not only the law that has to be passed and executed, we have to ensure that the people who are supposed to be responsible for maintaining law, that is the police, do their job properly. Instead, here is a classical example of the police favoring the criminals rather than the victims. This is very sad. The police force has to do their job. They can't be, they should be collecting the evidence and protecting the evidence. Instead, they are allowing the evidence to be destroyed. They are, initially, they tell the victim's parents that she committed suicide. Come on, this is ridiculous. So you see, her body is shifted from where the evidence was, that area is cleaned. This is really ridiculous state of affairs. How can we trust such a police force to give the proper evidence? And obviously, you just think of it, the court, even if they are serious about it and they take it up immediately, where is the evidence? The evidence has all been destroyed by the police and the people whom they have allowed them to destroy the evidence. This is very serious matter. I feel the police themselves have to be now hauled up in court.
Okay.
Yes, Uday.
Yes, let's leave it at that. My thanks to all of our guests for joining us on this discussion. It's time for a short break.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.